So I thought I'll try and build on your talk. Build on your talk, Mike, and sort of personalise it from my journey. I guess I've taken the path least travelled, and it has proven difficult, but I've persisted. And I'm doing two training pathways, essentially conjoint training. Currently I'm working at WACS in the southwest as a Regional Deputy Director of Medical Services, but I also am a medical registrar at Charlie's doing my physician training. As Mike alluded to, we both graduated in the same year, and this is where you're probably sitting at the moment, very close to finishing your medical school, thinking, great, we can have a break from the study and do some real doctoring. Unfortunately, it does only take a little bit of time before you realise you have to continue the study as you're working. So this was me with the additional issue of being very heavily pregnant in my internship year, trying to survive and trying to make sure that I do everything I need to do to look like a real doctor. And I've just got a few little snippets of what it feels like, I guess, to be an intern. And you feel like you're pretty much slaving away, trying to learn the system and hoping that you're doing a good job. I guess for me, I wanted to look at how you fit your life around training and choosing your specialty. And given that I was a mother quite early on in my training, I thought I'll just allude to some of the struggles of being a parent. And you do cry over spilt milk. I've done it many a time, I must say. And the thing to be important and to consider is that there's never a good time to plan to become, I guess, a parent or to have a family. You just have to make it work for you. Be kind to yourself. You can't do it all. And try and see how you can make the actual system work for you and have people help you out. It isn't easy working and studying and trying to do it all. This is how I felt for the first couple of years, especially after having two kids. Trying to see through my first couple of years as an intern, then a resident, really heavily reliant on coffee, having no time for myself, even struggled to use the bathroom without kids invading my space. And actually becoming the breadwinner, having a bit of a role reversal with my partner who's up the front here, who's now an intern himself. I think the important thing to consider, on top of the fact that you're probably not sure at this stage what pathway you want to take, is that you make sure in these early years that you take care of yourself and you take care of all those people who you work with. Because it does pay you down the track to look after your colleagues as they will look after you. It is difficult to balance life and balance your stress levels, and it's important to pay it forward to all the junior doctors. So as you become a registrar and you progress through any specialty, remember how it was when you started. It's important you take your toilet breaks. Okay, so I just wanted to say that during the time of sort of getting as much experience and rotating through the hospitals and seeing what it is that you actually enjoy doing, it's important you become really integral to the team and the team becomes really integral to you. I had to pull up some of the snapshots in my earlier years, and I can recall the nursing staff saving me with some sandwiches and something to eat, because you can be really flat chat whilst you're working. They will give you some gentle guidance if you forget to do something. Every criticism is an opportunity to learn. And as much as you like to think you've put your reflections in the past and at the end of medical school that you don't have to do them, you find that you actually do a lot of reflections and thinking back of what you could have done differently in a particular scenario with patients, and how that may help guide you in a specialty that you might end up doing, because it might actually shape your experience and it might shape your decision to go a different path or to continue down the same track. The thing that I would say, especially early in the years that you're training, particularly in your RMO years, is to Do as many rotations as you can, even the ones that you think you may not like. It might be the only time you get a chance to work in that field. You may think, I'm never going to be an oncologist, but I should do oncology. It might be the only time that you get to experience that, and somewhere down the track, a patient with an oncology issue will come to you and you will remember that term, and that might be the only thing you've got to help guide you from a clinical point of view. And also will be able to guide you on where you need to go to in terms of getting assistance if it's not an area of your specialty. Work in different health services if you can, if you've got the opportunities to work in public or private or even in the community. You don't know what's out there and how, I guess, medicine can work for you until you actually start doing things differently than everyone else. You might find that you had your thoughts set on a very traditional path, and it doesn't work out that way, and until you see what is out there and how you can actually change things up and actually go the path of, that isn't travelled as often, you won't get any idea what's out there. My other pearl would be that as you go through your training, talk to as many people who do different specialties as possible, collect mentors as you go. You will find that as you talk to consultants all the way through, that they themselves have changed their path and their decisions on where they wanted to go early on. They often have a unique story to tell, and it will very much possibly mirror your own as you progress through. It becomes invaluable to have people that you can turn to when you end up in training, and trying to find people that you can talk to about unique issues within training and getting onto programs, getting really realistic advice and to give you honest feedback about whether or not that specialty might actually suit you. And my other thing would be that we're in a very unique position as mature age people coming into medicine, and a lot of people would have had a different profession prior to coming into medicine, where you've got some other experience outside of this particular faculty. And we've got a really good opportunity to shape our environment that we work in at the moment. We've got a lot of old school mentalities that we could do without, and we really need some fresh blood to really get involved and change the space that we're working and we train in. Take every opportunity to travel and study when you can. That's a picture of my eldest daughter on Careers Day for her primary school. And here's a slide just to prompt me to sort of talk about what I sort of had to talk to, or consider when I wanted to look at a specialty. I ended up having to consider what interested me, whether I was a proceduralist or whether I liked to talk to people, what aspects of my job I enjoyed, I guess what I wanted my life to look like in 15 years down the track, because that's where you're working towards. What would that look like to you? And what outside of medicine is important to you, because as much as you spend your time at work, there are other priorities that you end up having, and you need to sort of fit that into your training consideration. As for me, I found that I love working clinically. I love talking to people, getting that interaction, working in a team, working in a hospital. But I also found myself falling into a particular role of wanting to improve the place I work in, seeing systems that didn't quite work and wanting to make a change, and feeling really frustrated that nothing would change. And I guess my part of my personality is not to complain about it, is if I don't like it, let's do something about it. And hence I sort of fell into the medical administration training pathway in addition to the physician pathway. It has proven to be very difficult, if I may say, mainly because the ways to get into physician training is very regimented and isn't as flexible as it could be. And I guess I tested the system very early on, wanting to return and complete certain aspects of both training pathways. And so I think this is why it's important that we are actively involved in changing how that looks like for us, because we're the ones that have to train in this space. In terms of milder interests, I find that, or I found for myself at least, that the more I did outside of, I guess, clinical work, or the more I took on voluntarily, the more opportunities opened up for me. And I would say that it is, if you ever get put in a position where you're offered an opportunity, really consider it, because you never know where that will take you. And it might not be somewhere you have originally planned to be, but it might end up being something that really works for you and your life. And until you actually really consider opportunities that present to yourself, you won't know where you can take medicine. I guess it isn't all very smooth sailing. The first couple of years of working and trying to decide what's important for you, there's many things that come up during that time when you're trying to balance everything. You may encounter things clinically, you may end up experiencing personal tragedy, having issues of health yourself, and having financial stresses and other things outside of work that can impact your decision on what path you take. And it's important that you make the time to nurture your relationships outside of medicine. That is just, I guess, a picture of my priorities, and I guess priorities change over time, they're not stagnant. And there is also a point in time when you see everything you see, you have medicine on the mind. It's probably time to give yourself a break of medicine and try and do something else that interests you. And I think that comes to the end of my talk, really. Does, I guess, anyone have any question for either Mike or myself?
We're probably running a little short of time. The next talk's bumping into us. We're getting the evil eye from outside the door. I'm hanging out at the Pathology College booth. Are you hanging out at one of the booths?
Yeah, I'll hang around. Yep.
Yeah. So you can catch up with us if you want to discuss anything.